Hello guys, hope you're all okay and you're all enjoying your life and you're also enjoying watching my videos and practicing radiology as well. Today I'm going to talk about one of the radiopharmaceutical. It's called as meta-iodobenzyl quinidine, using to detect the abnormal cells and abnormal growth of the cells within the body, and particularly used to look for the neuroblastoma, phaeochromocytoma, medullary thyroid cancers and carcinoid cell. As you know that the nuclear medicine is the branch of the radiology for the diagnostic purpose. So how this tracer will work, how it will pick all these abnormalities, and to what extent we can also appreciate a mild uptake of the normal tissues, all these information is included in this video. So let's start watching this video. Meta-iodobenzyl quinidine is radiopharmaceutical and it is used in nuclear medicine. Nuclear medicine is the branch of diagnostic radiology and uses for the purpose of diagnosis. Mainly the function of this radiopharmaceutical is to look for the uncontrolled or abnormal cell growth within the body. Meta-iodobenzyl quinidine is usually used to detect the abnormal growth or abnormal cell within the body, but this pharmaceutical is also taken up by the normal tissues. This would be considered as a normal uptake, and that would be of mild degree. So you can expect the uptake within the nasopharyngeal region, within the salivary glands. Thyroid uptake is also common. Myocardium can also be taking this pharmaceutical. Liver and spleen, mild uptake of the radio tracer can also be seen in the liver and spleen. Colon and bladder, eventually when it will pass through the kidneys and it goes to the bladder, so you can also pick the small amount of this radio tracer within the bladder. So mind you that this would be a normal uptake, this would be a mild degree uptake, and this should not be confused with the pathology, and it should not be considered that there is abnormal growth or abnormal cells within the salivary or nasopharynx or the myocardium or the area which is mentioned in the list. While analyzing the radio tracer uptake, you should have to have the patient's information with you, you should have to have the clinical record for the correlation, and then you have to look for the abnormal uptake of the radio tracer. So usually on the top, if there is phaeochromocytoma, so this would be taken up by the phaeochromocytoma, and you will not miss that because the high uptake of the radio tracer would be there. In the neuroblastoma, this tracer will show its increased activity, and you will pick that it is neuroblastoma. As far as the carcinoid tumors are concerned, carcinoid tumors in the bronchial tree, so you can pick increased uptake of the tracer within the carcinoid tumors. As far as paraganglionoma is concerned, paraganglioma is sensitive for this radio tracer, and radio tracer uptake or increased activity will be seen in paraganglioma. So far the medullary thyroid cancer is concerned, it will also shows its increased uptake. Mind you that we have also discussed that the small amount of the tracer can be picked up by the normal thyroid tissue. This would be quite distinguishable because the increased uptake will be seen in the thyroid medullary carcinoma. Ganglioneuroma will also shows increased uptake of the tracer. As far as this list is concerned, this is particularly for the uptake of this radiopharmaceutical, that is meta-iodobenzyl quinidine, and you can easily pick that up because the tracer will be high as compared to other normal tissues. So this is what the list is, where you can see that there will be increased radioisotopes uptake if there is all these pathologies within the body. Meta-iodobenzyl quinidine Actually, it is iodine 123. The tracer and the radiopharmaceutical is iodine 123, and its half-life is 13 hours, but it allows imaging up to 48 hours. If in case non-availability of the iodine 123, you can use 131 iodine, but actually the one thing at the expense of high radiation, because there will be a high radiation dose related to iodine 131. As far as meta-iodobenzyl quinidine iodine 123 is concerned, it's the best for imaging of all these phaeochromocytoma, neuroblastomas, carcinoid tumors, and etc. So it is the best one over the iodine 131 because it has a high radiation dose. For the adults, to reduce the radiation dose to the thyroid, 400 potassium perchloride is given 1 hour before the injection, and then the images would be taken. This is to reduce the radiation dose to the thyroid. So far, children are concerned, to minimize the dose and to reduce the radiation dose, it is important to give 0.1 to 0.2 ml Lugol's iodine. You should have to dilute in the water and give it 3 times a day, 48 hours before the injection, to reduce the radiation dose to the thyroid. Care should be taken while using the meta-iodobenzyl quinidine for the diagnostic purpose, because certain medication can interfere with this pharmaceutical. For example, if the patient is on tricyclic antidepressant drugs, so you should be very careful for using this radio tracer. The patients who are on antidepressant are those who are on antihypertensive. These both drugs having an interference with this radiopharmaceutical, so must be very careful while using this pharmaceutical for the patients having on antidepressants medications or antihypertensive drugs. Beside this drug also interfere with decongestant drugs. So these 3 categories, these 3 drugs must be kept in mind while you are using this radiopharmaceutical for the diagnostic purpose.